हेलो स्टूडेंट वेलकम टू आवर ओपी स्टडी चैनल। आपण मैंने जदि आम बैच रे जॉइन करने को चाहूँगी ताहले स्क्रीन में दि जाइथिबा कांटेक्ट नंबर रे कांटेक्ट करंतु। आम कांटेक्ट नंबर हेउची 6372270928। एही नंबर रे कांटेक्ट करिकी आपण मैंने आम सह OSSSC लैब टेक्नीशियन एग्जाम पई प्रिपरेशन करि परिबे। आज आम डिस्कसन करबा स्केलेटल सिस्टम रो बाकी 60टा एमसीक्यू विथ आंसर्स। Question number 1. Which bone forms the lower jaw? Option A maxilla, option B mandible, option C zygomatic bone, option D temporal bone. Right answer is option B mandible. Question number 2. The mandible is the dash movable bone of the skull. Option A second, option B largest, option C only, option D smallest. Right answer is option C only. Question number 3. The horizontal central part of the mandible is called option A ramus, option B body, option C condyle, option D coronary process. Right answer is option B body. Question number 4. Each ramus of the mandible contains option A coronary process and condyle, option B head and neck, option C body and angle, option D tubercle and notch. The right answer is option A coronary process and condyle. Question number 5. The temporal mandibular joint is formed by articulation of the condyle with the option A maxilla, option B temporal bone, option C zygomatic bone, option D frontal bone. The right answer is option B temporal bone. Question number 6. How many palatine bones are present? Option A 1, option B 2, option C 3, option D 4. The right answer is option B 2. Question number 7. The palatine bones form the option A nasal bridge, option B roof of the mouth and hard palate, option C lower jaw, option D orbit. The right answer is option B roof of the mouth and the hard palate. Question number 8. How many zygomatic bones are present? Option A 1, option B 2, option C 3, option D 4. Right answer is option B 2. Question number 9. The zygomatic process forms the option A nasal septum, option B zygomatic arc, option C hard palate, option D mandible. The right answer is option B zygomatic arc. Question number 10. The lacrimal bones are found in the option A interior of the orbit, option B lower jaw, option C neck, option D thorax. The right answer is interior of the orbit. Question number 11. The nasal bones form the option A nasal bridge, option B hard palate, option C zygomatic arc, option D nasal cavity floor. The right answer is option A nasal. Question number 12. Interior turbinate bones are also called option A nasal conchae, option B palatine bones, option C lacrimal bones, option D zygomatic bones. The right answer is option A nasal conchae. Question number 13. The vomer forms the option A upper jaw, option B lower part of the nasal septum, option C nasal bridge, option D hard palate. Right answer is option B lower part of nasal septum. Question number 14. The hyoid bone is option A U-shaped, option B V-shaped, option C circular, option D flat. The right answer is option B V-shaped. Question number 15. The hyoid bones has a body and option A 2 greater horns only, option B 2 lesser horns only, option C 2 horns called greater and lesser horns, option D 4 processes. The right answer is option C 2 horns called lesser and greater horns. Question number 16. The scapula lies at the option A front of thorax, option B back of thorax, option C lower abdomen, option D neck. The right answer is option B back of thorax. Question number 17. The scapula forms the posterior part of the option A pelvic girdle, option B shoulder girdle, option C vertebral column, option D thoracic cage. The right answer is option B shoulder girdle. Question number 18. The scapula has how many angles? Option A 2, option B 3, option C 4, option D 5. Right answer is option B. Question number 21. The posterior surface of scapula is divided by the option A coracoid process. Option B. Spine of scapula. Option C. Acromion. Option D. Glenoid cavity. The right answer is option B. Spine of scapula. Question number 22. The fossa above the spine of scapula is called option A. Infraspinous fossa. Option B. Supraspinous fossa. Option C. Subscapular fossa. Option D. Glenoid fossa. The right answer is option B. Supraspinous fossa. Question number 23. The fossa below the spine of scapula is called option A. Supraspinous fossa. Option B. Infraspinous fossa. Option C. Subscapular fossa. Option D. Glenoid fossa. The right answer is option B. Infraspinous fossa. Question number 24. The glenoid cavity receives the option A. Head of radius. Option B. Head of ulna. Option C. Head of humerus. Option D. Head of clavicle. The right answer is option C. Head of humerus. Question number 25. The superior angle of scapula is formed by the junction of option A. Superior and medial borders. Option B. Medial and lateral borders. Option C. Superior and lateral borders. Option D. All three borders. The right answer is option A. Superior and medial borders. Question number 26. The inferior angle is the highest. Option A. Highest point of scapula. Option B. Lowest point of scapula. Option C. Lateral point of scapula. Option D. Medial point of scapula. The right answer is option B. Lowest point of scapula. Question number 27. The lateral angle of scapula contains option A. Acromion. Option B. Glenoid cavity. Option C. Subscapular notch. Option D. Interior angle. The right answer is option B. Glenoid cavity. Question number 28. The clavicle is also called the option A. Breastbone. Option B. Collarbone. Option C. Shoulder blade. Option D. Arm bone. The right answer is option B. Collarbone. Question number 29. The clavicle forms the option A. Posterior part of shoulder girdle. Option B. Anterior part of shoulder girdle. Option C. Lower part of thorax. Option B. Vertebral column. The right answer is option B. Anterior part of shoulder girdle. Question number 30. The medial end of clavicle is called the option A. Acromial end. Option B. Stemmal end. Option C. Lateral end. Option D. Vertebral end. The right answer is option B. Sternal end. Question number 31. The lateral end of clavicle is called the option A. Stemmal end. Option B. Acromial end. Option C. Medial end. Option D. Vertebral end. The right answer is option B. Acromial end. Question number 32. The longest bone of the upper limb is option A. Radius. Option B. Ulna. Option C. Humerus. Option D. Clavicle. The right answer is option C. Humerus. Question number 33. The head of humerus articulates with the option A. Glenoid cavity. Option B. Acetabulum. Option C. Trochlear notch. Option D. Radial notch. The right answer is option A. Glenoid cavity. Question number 34. Which structure is found below the head of humerus? Option A. Anatomical neck. Option B. Deltoid tuberosity. Option C. Spiral groove. Option D. Capsulatum. Option D. Capitulum. Right answer is option A. Anatomical neck. Question number 35. The greater tuberosity of humerus is located option A. On the inner side. Option B. On the outer side of upper extremity. Option C. At the elbow. Option D. At the wrist. Right answer is option B. On the outer side of upper extremity. Question number 36. The bicipital groove lies between the option A greater and lesser tuberosity, option B capitulum and trochlee, option B radius and ulna, option D medial and lateral epicondyles. The right answer is option A greater and lesser tuberosity. Question number 37. The deltoid tuberosity is found on the option A radius, option B ulna, option C humerus, option D scapula. The right answer is option C humerus. Question number 38. The radial nerves passes through the option A bicipital grooves, option B spiral by radial groove, option C trochlear notch, option D radial notch. The right answer is option B spiral by radial groove. Question number 39. The trochlee of humerus articulate with the option A radius, option B ulna, option C scapula, option D clavicle. The right answer is option B ulna. Question number 40. The capitulum of humerus articulates with the option A radius, option B ulna, option C scapula, option D clavicle. The right answer is option A radius. Question number 41. The ulna is the dash bone of the forearm. Option A outer, option B inner, option C interior, option D lateral. The right answer is option B inner. Question number 42. The radius is the dash bone of the forearm. Option A inner, option B outer bilateral, option C posterior, option D medial. The right answer is option B outer bilateral. Question number 43. The coronary process of ulna is option A projection in front, option B a projection at the back, option C at the wrist, option D on the radius. The right answer is option A projection in front. Question number 44. The olecranon process of ulna is option A an upward projection at the back, option B a downward projection, option C a part of radius, option D a part of scapula. The right answer is option A an upward projection at the back. Question number 44. The trochlear notch of ulna articulates with the option A capitulum, option B trochlee of humerus, option C head of humerus, option D glenoid cavity. The right answer is option B trochlee of humerus. Question number 46. The head of radius is located at the option A upper extremity, option B lower extremity, option C middle of shaft, option D wrist. The right answer is option A upper extremity. Question number 47. The biceps tubercle is also called option A ulnar tuberosity, option B radial tuberosity, option C deltoid tuberosity, option D greater tuberosity. The right answer is option B radial tuberosity. Question number 48. The bone of wrist are called option A metacarpals, option C carpals, option B carpals, option C phalanges, option D tarsals. Right answer is option B carpals. Question number 49. The carpal bones are arranged in option A 1 row, option B 2 row, option C 3 row, option D 4 row. Right answer is option B 2 rows. Question number 51. The second row of carpal bone includes option A scaphoid and lunate, option B trapezium, trapezoid, capitate and hamate, option C pisiform and tricutrell, option D radius and ulna. The right answer is option B trapezium, trapezoid, capitate and hamate. Question number 52. The thumb has how many phalanges? Option A 2, option A 1, option B 2, option C 3, option D 4. The right answer is option B 2.